just carry on with what you're saying.
My name's Dr. Sarah Myhill. I have a special interest in allergy and nutritional medicine. I've learned this over 20 years in NHS general practice, and I now practice in private general practice.
Right, thank you. And so what is happening here today?
I face two allegations today. I have learned a huge amount of useful information which has a sound, scientific and logical basis over the last 30 years. As a result of that, I have more patients than I can possibly cope with. But the advice that I give my patients is very simple. Ordinary dietary changes, nutritional supplements, lifestyle changes, which can make the world of difference to sick patients. There is no reason why this information shouldn't be generally available to a wider world, and so that was the aim of setting my website, to convert that practical knowledge and that scientific foundation into something that they could use. And it is the result of that website and the information that's there that I face the GMC today, who have construed the information within that website as being a potential danger to public health. In the last 20 days, since I was informed of this hearing, I've received over 800 letters, or rather copies of letters that have been sent to the GMC by patients and the wider general public endorsing this approach to treating illness. Many of these people who got well have done so with no help from me, simply from the knowledge they've used on the website. There's been an online petition that now has 3,500 signatures, and along with the Facebook blogs, I think it's up to about 1,200 Facebook blogs or something. So there are literally thousands of people out there who I have never seen who have been helped by my website. And what I'm saying to the GMC is that if they suspend my licence to practice, or they suspend the website on the basis of a potential risk to public safety, my view is that it will actually be damaging far more people in the process.
How many patients do you actually have?
I'm not like an NHS general practice. I don't have static patients. It's a rolling process. So I see new patients. Very often I will see somebody once and they will recover on the basis of that one consultation. Most people end up with 2 or maybe 3 consultations, and then with what I have told them, with the information on the website, they can then go ahead and effect their own recovery. And what I'm trying to do is empower patients with the knowledge and with the tools to take control of their own health.
Right. Now these you would generally diagnose as ME/CFS patients.
What is unique about this is not the people that I see, but the approach. The approach is all about looking at the mechanisms by which people become ill. The reason I have attracted so many CFS ME patients is because conventional medicine has very little to offer them. Conventional medicine is not looking at the mechanisms by which these patients become fatigued. In January 2009, I published a paper together with Dr. Norman Booth from Oxford University and Dr. John McLaren Howard, which is a biochemical test which looks at mitochondrial function. Mitochondria supply energy to cells. If the energy level to cells is impaired, the cell goes slow. The cell goes slow, the organ goes slow. If the organ goes slow, we go slow. And so the clinical syndrome we see is chronic fatigue syndrome, ME. And there has been an extraordinarily close correlation between how bad the mitochondrial function is and how bad the patient is. And that is, say, have been validated in a proper controlled trial.
Right. And so what age are the patients that come into you? Is there a kind of...
There's no age limit at all, because, as I say, it's approach specific, it's not patient specific. There's a lovely lady, Patricia Chell, who appeared on BBC Radio, I beg your pardon, BBC Television Wales yesterday, who was admitted on 3 occasions with very severe heart failure. She should have died. She came to me, I gave her magnesium injections, and she now gardens. She's 88. She's a very happy lady.
Right, that's great. You okay?
Good.
So, what's your theory or your reaction to the XMRV virus discovery over in the States?
I think it's absolutely fascinating. It clearly puts chronic fatigue syndrome, ME, in the physical camp. I am not sure how relevant that will be for treatment in the longer term, because what I suspect, but I don't know, is that getting that virus is symptomatic of poor immunity. So any treatment that is developed for the treatment of XMRV also needs to be done in combination with the general approach to being well, i.e. a good night's sleep on a regular basis, a good Stone Age diet, a diet which is rich in micronutrient supplements, and so on and so forth. And if we can put all those things right, then there's no reason why these patients shouldn't recover. It's all about addressing the causes. Once you identify the causes and then you address them, the body can heal itself.
So this morning you've had the hearing.
Indeed, yes.
And you don't know the result yet?
No, I don't know the result yet. Because of the massive support that I've had from my patients and the very high public interest in this case, I think the GMC have almost backed themselves into a corner. I think they will find it very difficult politically to let me walk free. And I was aware of this when I went into the case, and that's why I argued my case as strongly as I could. If you could have seen the way in which the prosecuting counsel's face fell as I detailed my response to his assertions, and if you look at the content of my case, you would say, as indeed my QC said, there is no case to answer. But this isn't just about the facts of the case, this is a highly political issue as well. And that's, my guess is that the GMC will be paying as much attention to that as to anything else.
Why do you suppose they took so much attention? Can you just tell me, was it one person that complained?
One person complained about me recommending B12 injections to a patient. The other complaint was anonymous. It came from through the internet, and the complainant later identified himself on the internet as the complainant, and made highly derogatory comments about me. The complaint he construed during his coffee break, and to his own surprise, the GMC took it up and ran with it. The interesting thing about this is not the nature of the complaint, but the fact that the GMC chose to run with it.
That's my question. Why on earth do you suppose they reacted that way?
I think that that is symptomatic of a wider establishment view to try to preserve the current medical ethos, which is based around the prescribing of pharmaceutical drugs. And I find it astonishing that they find a little person like me working in the middle of Wales with entirely safe and effective interventions a threat. And I think, well, I don't know what to think. I just find it extraordinary.
So what is your thoughts of the NICE guidelines?
The NICE guidelines adopt the psychological approach to chronic fatigue syndrome. Their view is that a bit of exercise, a bit of cognitive behaviour therapy, a bit of antidepressant, and they'll get well. The problem with the NICE guidelines is they're not addressing the fundamental questions, i.e. why. Why is this patient fatigued? And so if you don't even ask the right question, you have no hope of finding the right answer. And they're into managing the levels of fatigue. Okay, we all need to pace our activities, whatever our level of energy is. They're not into addressing the root causes of.
What are GPs across the country doing with people that come to them with ME/CFS-like symptoms?
It very much depends on the individual GP, but the majority of them are following NICE guidelines. The majority of them are following NICE guidelines, and in the process they are often making their patients more ill.
Why?
Because if graded exercise therapy helps patients with fatigue, then by definition they can't have had fatigue in the first place, because that is the one thing certain to make them worse. We're going to have to get on now, I think.